Good evening to everyone present here with us today. This is Shriyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by your keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Vicky Jain. Sir is MBBS, MS General Surgery, MCH Plastic and Reconstructive Surgery consultant at the Aesthetic Clinic, Mumbai. With the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is innovation in post-bariatric body contouring surgery. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Yeah. So, hello friends, I'm Dr. Vicky Jain, plastic and cosmetic surgeon, and I presently practice in the city of Mumbai. And so, today I'll be presenting about the post-bariatric surgery, what we have to do and what we can do in plastic surgery. So, as I have opened my presentation, it says, yeah. So, can you see my screen, ma'am?
Yes, sir. It is visible.
Yeah. So post-bariatric body contouring procedures. So as Madam told you, I'm an MC plastic surgeon, and I have fellowship in aesthetic surgery in Switzerland, and laser surgery also. So after massive weight loss, excess skin. So these all plastic surgeries are done for addressing excess skin after massive weight loss. Disclaimer: the images are for courtesy Google search. So some basic information: what is bariatric surgery? Procedure aimed at helping individual with severe obesity to lose weight by making change in the digestive system, such as stomach, intestine. This is typically recommended for those with BMI over 40 or those who have BMI above 35 who suffer from obesity related disorders such as diabetes, hypertension, sleep apnea, a lot of other things. Type of bariatric surgery is gastric bypass. This is a more invasive surgery in which we connect your stomach directly to the small intestine. So we bypass the gastric. Sleeve gastrectomy is removing a part of a stomach, and adjustable gastric banding, which we apply over the stomach. A small band is applied over the stomach, and nowadays there is alluron balloon also, which can be used for the capsule, which you take in, and then you put fluids, and that balloon passes after 120 days. So the aftermath of weight loss surgery is challenges post-bariatric surgery, excessive skin, loss of skin elasticity also. So skin doesn't contract, it doesn't get back the tone which is required. The emotional and physical impact on the patients. This is the most common cause. Physical problems such as rashes, infection, chafing, difficulty in exercising, fitting into the clothing. Emotionally, patient may feel dissatisfied with their appearance, impacting self-esteem, confidence, and despite their weight loss success, which have gone after the surgery. So, what is body contouring? Body contouring surgery refers to a set of procedure aimed at removing excess skin, tightening tissue, and improving the overall appearance and shape of the body after significant weight loss. This can be post-bariatric as well as your weight loss journey yourself by dieting and exercising. How it works: the surgery removes the redundant skin and underlying tissues, and in some cases may tighten the muscles underneath to give a smoother contour. So goal is aesthetic improvement, to give the body the better shape, functional improvement, removing excess skin, maintaining hygiene, decreasing skin irritation, making patients to live better in day-to-day activity and exercises. Enhance confidence is very important in social situation. They can wear what they want to feel. A boost in self-esteem is there. Eligibility: you should have a stable weight for 6 to 12 months, and you have to make sure that it is not fluctuating. So the surgery is done at the present, considering your how skin is lax. If you put on weight, you might have a more fullness in your skin, and if you lose weight, you have more sagging. General good health: patient need to be in overall general good health. Diabetes, if there, blood pressure there, if any comorbidities, have to be under control. Realistic expression: patient should have a realistic goal while undergoing body contouring surgery. He should understand symmetry is not a part of a body. My both eyes are not symmetrical. My both nostrils also not symmetrical. So they have to understand symmetry is not a part, and we might achieve near to perfection. Perfection is never part of a body, and there are scars. The psychological aspect is also significant. We have to understand the psychology of the patient before going under taking them under the knife, because some patients can be sometimes a pain. Can bother you all your life. The pre-surgical conditions, we have to make sure that the nutrition status is there, because we have to consider micronutrients, macronutrients, everything, because they have a lot of deficiencies because of reduced food intake. Smoking can hinder healing and increase the complications and tissue necrosis. So we prefer that they stop smoking at least 2 to 3 weeks before surgery. And alcohol cessation can interfere with anesthesia and post-surgery recovery. So the recovery period varies on the type of surgery. For example, for paniclectomy, it can be 3 to 4 weeks, while lower body lift might take 2 months. Most patients return to light activities within 1 2 weeks, but heavy lifting and exercise should be avoided for 1.5 to 2 months. Scarring, while surgeon try to place the incision in the less visible scar, we cannot avoid scar. We have to hide scar. Scarring is inevitable, as I say, and scarring is a remnant of healing. So anywhere the healing is happening, there can be scarring. So over time, the scar will fade, but may disappear, may not never disappear completely. Scar management treatment includes silicone sheets and laser therapy, which may reduce their appearances. Post-operative care, wound care has to be taken, dressings might be required. Any infection should be reported immediately to doctor. Because these procedures are along with some amount of liposuction. So pressure garments, these garments help minimize swelling, improve blood circulation, and support healing tissue. Pain management include to prescribe pain medications are always given to make sure that the journey after surgery is smooth. Patients should follow the surgeon's guideline and should not take medicines on their own over the counter, which can cause drug abuse also. Risk and complication, potential risk. Anywhere I cut, there are chances of infection, bleeding, hematoma, scarring, and seroma. Seroma is something like a fluid collection which happens between your skin and a muscle. There's nothing to worry. They can be sometimes recurrent, so we have to make sure that we tap the seroma. Complications, follow-up surgeries might be required. Uh, in rare case, revision surgery might be needed to correct issues such as asymmetry, scarring, or dissatisfaction. Early intervention, early detection of complications like infection and tissue necrosis is vital. The follow-ups with the surgeon allows for prompt intervention and a better recovery. So physical benefits are improved body shape, comfort, hygiene, psychological boost in self-esteem, and improved quality of life. So common areas of body contouring are abdomen, breast, arms, thighs, face, and buttocks and back. So abdominal contouring, there are two procedures which we do: paniculectomy and abdominal tummy tuck, abdominoplasty. So panictomy involves the removal of the hanging pannus, like a large apron of skin that develops after significant weight loss, especially around the lower abdomen. This can improve immobility, hygiene, patients who experience recurrent rashes or infection. Benefits, functional improvement rather than just aesthetic changes. The scar run horizontally across the lower abdomen, but can be based on the amount of skin to be. So this patient requires pancreatomy. This courtesy Google images only. Abdominoplasty is similar to pancreatomy, but with additional step of tightening the underlying abdominal muscles, giving the abdomen more toned and a flat appearance. Primary, it is done for post-bariatric as well as a females who want to look better. This can be done post-pregnancy also, a mommy makeover. Scarring, the scar runs from hip to hip, just above the pubic area, but the location is such designed that it can be covered under clothing or swimwear. Arm contouring, excess skin after significant weight loss. You have patients have sagging skin on the upper arm, so this can lead to a bat-wing appearance. Removes excess skin fat from the upper arm, resulting in slimmer and more toned appearance. The incisions are placed along the upper inner arm, often around the armpit, from the armpit to the elbow, to remove the excess skin. Liposuction also invariably a part of it. Recovery, swelling and bruising are common in early recovery period. Patients typically wear compression garments to minimize swelling and support the healing process. Risk scarring is a very important part, but most incisions are placed in a hidden area, so scarring is very barely visible. So this is how it is done. Thigh lift, there can be two types of thigh lift: inner thigh lift as well as outer thigh lift. Most commonly, it is done for the inner thigh lift because we have a lot of hanging skin inside in the medial thigh. So focus on tightening along the inner thigh where sagging is most common after weight loss. Lateral thigh, improve the contour by removing the excess skin. procedure. For medial thigh lift, incisions are usually hidden along the groin case or inner thigh. For lateral thigh lifts, incision may extend around the hip area. Skin tightening. After removing excess skin, the surgeon tightens the remaining skin and closes the incision with sutures. Recovery is safe, and we have to wear compression garments to make sure that their complications are bare minimum. This is a medial thigh lift procedure. Breast lift and augmentation. So post surgery, the breast has, as we say, breast has fat as well as breast tissue. So post bariatric surgery, you will have sagging of the breast. There will be volume loss, causing deflated appearance, and there will be excess skin also. So mastopexy can be done, and breast implant can also be done. So there's a different topic itself. A lot of people do it. So this is a female who has gone meet paniclectomy with a breast lift at the lower body lift. It's a comprehensive contouring of the lower body areas. The lower body lift targets the abdomen, thighs, hip, and buttocks in one comprehensive procedure, removing excess skin and tightening muscle whenever needed. So circumferential incision is taken all around 360 degrees around the abdomen, and which lifts the lower body to remove the excess skin and tightens the underlying muscles. So muscle tightening is a part of it, in which we make sure that we tighten the rectus, and it is always combined with liposuction also. So facelift and neck lift is done to target the excess skin over the face as well as the neck to bring them, and the incisions are typically placed along the hairline behind the ears to minimize the excess visible scarring. Summarize body contouring. So post-bariatric body contouring is significant but a life-enhancing step for many weight loss patients. It helps resolve the physical and emotional challenges associated with excess skin, enabling patients to fully enjoy the results of their weight loss journey. Importance of a individual planning. Each patient's situation is unique. A customized surgical plan should be developed in consultation of a skilled plastic surgeon to address specific concern and achieve the best possible results. The final thought: deciding to undergo body contouring is a major decision that should be made after thorough research, consultation, and reflection. Understanding the risk, benefits, and recovery process is essential for successful outcome. So, excuse me, the patient has to be sure. He should think and do it rather than doing and thinking about it what went wrong. Thank you. Yeah. Hello.
Hello, sir. Thank you for the wonderful presentation, sir. We do have some
Thank
question
you.
if you like to take that up.
Yeah.
So, the first question is, what are the key consideration when planning post-bariatric body contouring surgeries?
So we have to be sure that the patient has realistic expectation. For any cosmetic surgery, it's a purely optional, non-emergency surgery. So we have to understand the psychology of the patient, that he will be happy. If a sad patient is there and he's sad, 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 and he will create nuisance later, and the patient is following, he's more compliant with our thought process, which are telling that he has to stop smoking, he has to have taken his vitamins and proteins on time, he has to have a static weight. That's where these are the key consideration, and it's a personal touch where we understand with the patient that is he the right person or not.
So, the next question is, how does the approach to body contouring differ for patient with massive weight loss versus moderate weight loss?
So massive weight loss patients have a lot of excess skin. Moderate weight loss, मतलब, a person who has a BMI between 30 35 has come to 25. So the skin is not that sagging. So we need to be less aggressive. That's where the cosmetic procedure comes into the picture. But for massive weight loss, the patient is happy with the suboptimal results also, which we think suboptimal, but for him it will be very, very amazing results. But for massive weight loss, there can be a lot of vitamin deficiencies, and body healing can be giving a problem. So we have to be sure. I'm telling you again, we have to make sure that his hemoglobin is up to date, his B12 level, vitamin D level, everything which can cause issues. And after surgery, also we have to give him a lot of supplements, food supplements, to get him back on shape.
Thank you. So, there's one last question. What are the key risks and complications associated with post-bariatric body contouring, and how have innovation helped mitigate these?
So basically, more vigilance, better cauteries, better machine for liposuctions have helped to get lesser complications. And with scarring, a major complication, we have to be sure that we can give lasers to the patient, we can give silicone sheets and everything. So everything is available right now, but it is an individual patient's body how it's going to respond to the incision. So we desire that no patient has any incisions or scars, but it's a personal this thing. Someone might eat two chapatis and become fat, and someone might eat four chapatis also and can become thin. So every body has a different metabolism, different healing. So we have to explain this to the patient, and I don't see any problems with that if the patient has understood in detail about everything.
Thank you, sir. That's all from our audience, sir. Before concluding, any take home message from your end?
So weight loss should be avoided because more weight should be avoided according to me. We have to take care of our health. COVID has given us enough opportunity and advice that obesity is a very risk factor which can cause a lot of nuisance. So make sure that you take your body slow, you eat less, take care of your diet, exercise, and make sure that you don't require all these kind of surgeries.
Thank you, sir, once again for joining us today. And with your permission, sir, I would like to conclude today's session. Thank you.
Thank you everyone. Thank you, colleagues, and you. Thank you. Bye bye.